So we're going to be going over the advanced level psychomotor exam for IV therapy and intravenous bolus medications. So the first thing, when you go into the room, they are going to introduce themselves, and then they will get your name, information, put it down on paper, and then they will read you a set of instructions. These instructions are going to be the same across the board no matter where you are. Those are going to be something to the effect of, welcome to the intravenous therapy skill station. In this skill station, you're required to establish an IV just as you would in the field. You will have 3 attempts within 6-minute time limit to establish the IV. Although we are using the mannequin arm, you should conduct yourself as if this were a real patient. You should assume that I'm the actual patient, and you may ask me any questions you normally would ask a patient in this situation. Do you have any questions? It is really important, if you have questions, ask them. Take a minute, look at the equipment. You have a few minutes to look, okay? So look, make sure that you have everything that you actually need. We know we're going to need fluids, so make sure you've got fluids. We know we're going to need a drip set, so make sure you've got a drip set. We know we're going to need a tourniquet, we're going to need tape, we're going to need some kind of alcohol prep or something. We're going to need needles, we're going to need medication administration stuff. So make sure, take a few minutes, look, and make sure that we've got everything that we actually need to do the skill. Now, me personally, if I have room, I like to kind of lay it out in the order that I would be performing this skill. For instance, I'm going to need gloves before I need my IV catheter. You know, I'm going to be putting my stuff together first. Then I'll be tearing my tape. Then I'll be putting on my gloves. Then I'll be cleansing the port. Then I'll be putting on my tourniquet. So I like to kind of put it in order, but that's just me. So the first thing we're going to do is we're going to look, and once we're ready, we let them know that we're ready. The timer will start, and we're going to let them know. So we're going to check our fluids. The first thing we're looking for is clarity, okay? First thing, is this the right fluid? Okay, so this is 0.9% sodium chloride, so this is the correct fluid that we want to give. We're looking, is it clear? Is there anything funky, floating, discolored? I don't see anything, so we're good there. And then we're going to look and make sure it's not expired. Now, this is a demi-dose, so it doesn't have an expiration date, so we're going to say for giggles that this is not expired. We are good, okay? Next, we're going to look and see the appropriate catheter. We've got an appropriate catheter right here that we will use. Then we are going to look at the proper administration set. Now, there's a lot of different sizes that you may encounter, but primarily for this skill, you're going to be looking at a 10-drop set. You want to make sure that you're getting a 10-drop set. You may see 60. Okay, 60 is primarily used for pediatrics and for administering drug drips when you are going to need to more closely watch the fluid amount that you are giving. You can tell the difference out of the package if you look right there. There you go. Right there, there's a little tiny metal needle in this drip chamber here. That lets you know that that's a 60 drop set. When we say drop set, that just means, for instance, this one, 10 drops, that means that 10 drops out of this equal 1 milliliter. So they're going to be a little bigger drops. A 60 drop set, 60 drops will equal to 1 milliliter. So for this, we're going to use a 10 drop set. So now we're going to connect the IV tubing to the IV bag. So we're going to open it up. Okay. Put this in our trash. Now you've got protective ports here. We want to leave this on until, right here, we want to leave this on until we're ready to use this because this helps maintain it being sterile. I'm going to open up here. Take that out. Now I leave this on because otherwise it turns into a hot big mess until I'm ready for it. We have protective tails again. We've got one right here and we've got one right here. We want to leave those on until we're ready to use this, otherwise it is no longer sterile. So we're ready to spike our bag. So we're going to, it wants to come off, we're going to take that off. We're going to take off our cap and not touching it, we're going to insert it with a pushing, kind of twisting motion. Get it in there. All right. We're going to flip it over. We're going to give this a little squeeze, get it about halfway full. Open our drip chamber here, all the way up, and we're going to watch. And we're going to watch the bubbles flowing through until we exit here. All right. Once we've got all the bubbles out, I'm going to roll this shut. Now notice we've still got our protective tail, our protective cover on here. All right, you can clear the tubing with that on there, it'll flow around it. So now this is ready to go. So we set this to the side. Now we are going to tear some tape. is a little bit bigger than I would probably normally use, but that's what I've got, so this is what we're going to work with. We're going to tear a couple pieces of tape, but we'll make sure you do this beforehand because you do not want to try to tear tape one-handed holding an IV in with the other hand. Usually doesn't work out too well. Alright, so we've got our tape torn. Now we are going to put on our PPE, our proper gloves. You can go ahead and put your gloves on at the beginning if you would like. You do not have to, that is up to you. I usually put them on after I tear my tape. I've never been very good at tearing tape with gloves on. That's just one of my weirdnesses. But so we got our gloves on now. All right, you want them tight enough to do the job. You can feel, but not so. You don't want them super baggy and loose, but you don't want them ripping either. So next thing we're going to do, we got our PPE. We are going to apply our tourniquet. Okay, we're going to apply it in an appropriate manner. You want to make sure that you leave the little kind of little tail there where you can do a quick release. All right, we're going to palpate a suitable vein. Now imagine this. Little Susie right here has a great vein right here that we're going to stick. Okay, so we've palpated the suitable vein. It's good. Suitable vein is going to be springy. You should not feel a pulse in there. So you always want to palpate with your fingers. Make sure it springs. Make sure it's not a tendon or an artery or anything like that. Now we're going to cleanse the site appropriately. So appropriately depends on what kind of cleansing thing you're using. In this case, we're going to use alcohol preps. With alcohol, it is bacteriostatic and bactericidal, so it doesn't kill everything. It chases some of them away in essence. So you want to start in the middle, work your way out, big circles. Once you get it done, you have to let it dry. It has to dry in order for it to start doing its job. If you just swipe and go, you haven't done anything but just move some bacteria around. So small circles to big circles, inward to outward. All right, and then we're going to trash that. We're going to let this dry. Do not go back and touch that vein once you find it. Trust that it is there. If you need to mark it before you clean it or something, do what you got to do, but make sure that you don't go back and touch your site after you have cleansed your port. All right, so next thing we got our needle here. Some people like to kind of loosen that a little bit. If you want to loosen it, make sure that you do not pull it over the end of the catheter, because that little piece of plastic there can get caught on the bevel and it can actually cause catheter shear where a piece of the plastic rips off and goes floating through their vein. We don't want that. Now if you look right here, I don't know how I was going to pick up on this, but there's an angled edge right here. We want to make sure that that bevel is up. The angled edge is on the top side. So we're going to come here. There's a couple of different ways, and as you progress through this, you'll find what way works best for you. Sometimes, for me, it depends on the patient. You know, some patients I may hold kind of like this, some I may hold and pull the skin tight, some I may do like this. It just varies on where I am and what the patient's like. All right, so we're going to hold everything, and we are going to take our needle. You're going to insert it, you know, somewhere in the neighborhood of a 40-45 degree angle. Once again, it depends. You don't want to come straight in. You don't want to go too shallow. It just depends on the patient's skin, their veins, how much subcutaneous tissue they have, all that stuff. All right, so we're going to come in an appropriate angle, insert till we feel a little pop, and then we should see flashback. Now, in this situation, I don't have the blood hooked up to this arm, so I'm not going to get flashback. So I'm going to verbalize that I got flashback. All right, now we're going to advance it, just the catheter, not the needle. All right, and we are going to occlude. Now you see how far away I am from the catheter? Here's the catheter, there's my finger, or my thumb. You want to make sure that you don't occlude right here, because you're not going to occlude anything there. You're going to make a big mess with blood. Occlude at the end of the catheter. All right, pinch that vein kind of below the catheter, and that'll help minimize any blood loss. We're going to withdraw the needle. It's going to go into the sharps container. All right, now we are going to take our stylet right here, our tubing. Now we are going to remove that cover. We're going to connect it, screw it down. I'm going to lose our tourniquet here. Okay. We are going to open our bag. We would hang it here. We're going to open it. We're going to flow, make sure it's flowing. It is flowing. So we're going to take a piece of tape here. I like to give it just a little tape down there. Just kind of hold it in place while I get the rest of it. Some people use a chevron. Some people use it loop, and there's a whole bunch of different ways. Some people will use Tegaderm. It just all depends on what you have available. For this, we're just going to make it not so pretty and just tape that down like that securely. All right, we're going to run it. Make sure it is patent. If it is patent, then you should see, which I've got mine closed off here, you should see drips. See it? Oh, you can't see it, it's too high. You should see it flowing right in here like it is right there. All right, and we're going to back it down to an appropriate rate, so we'll do it down to a TKO and make sure it's secure, and then we are complete with this skill. And then we're going to move on to the intravenous bolus medication. So we're going to verify, do you have any allergies? And the person will say no. All right, hopefully no. Then we're going to select the correct medication. So like I said, they're going to give you that easy, fairly obvious problem. So let's say it could be, you know, it might be somebody who is breathing 6 times a minute with pinpoint pupils, unreactive to light. Well, probably going to need some Narcan. Okay, if they're nauseated and vomiting, Zofran. You know, if they have a blood sugar of 20 and they're unresponsive, D50. So it just depends, but you'll have a kind of array of medications. You'll have some options as far as medications to draw up and to flush. You'll have your different things there. So you'll pick whichever medication it is based on what information they give you. So let's just say this one, we'll go with the breathing 6 times a minute and the pinpoint pupils. So we know we need Narcan. All right, so we've selected the correct medication here. And we're going to confirm the correct concentration of medication. So we're going to look at this, and we're going to see this is naloxone hydrochloride injection. Okay, 2 milliliters, 2 milligrams. So we have a concentration of 1 milligram per 1 milliliter. Okay, we have just assured the concentration. Now we are going to assemble this pre-filled syringe correctly. On these things, the yellow stuff comes off. Okay, comes off, screws on. Now it will slide up and down in this tube. If you push it in this way, it's going to come out. You've got 2 options on this particular one. You can take this yellow top off and you've got a lure lock, or you can take the whole thing off if you have a needled port and you can use the needled port. Ideally, you want to use the non-needled if at all possible. It's going to be safer. Okay, so we're going to take the yellow port off. So now we've got our ports out. Now we're going to look at, see there's a little bit of air right here. So we're going to distill that air. So now we have no air, we have just medication. So now we want to give 0.5 milligrams of naloxone to this patient, okay? We've still got our PPE on, make sure that we acknowledge we still have it on. We've reaffirmed we've got Narcan. You can even confirm I've got Narcan. I'm giving 0.5 milligrams. So I want to give 0.5 milliliters, right? Okay, now we're going to find our port closest. Now we can take that off. Find our port closest to the site. Now that's going to be this one right here. Okay, this is a lure lock port. So we're going to take an alcohol prep. We are going to stop our flow. Okay, flow stopped here. I also like to pinch it just because it's just me. I like to pinch it. I feel more control. I'm going to take my alcohol prep. I'm going to cleanse my site. Okay, I'm going to insert appropriately. And I'm going to administer, I can see it now, 0.5. There we go. I'm giving 0.5. Now, take that off. We are going to open our flow rate back up. We're going to dispose of this in the appropriate container. If it's a sharps, it would go in the sharps container. If it is not sharps, you may put it in the red bag. It just depends on whatever your appropriate facility is. For this one, we'll put it in the sharps. We're going to open this up. We've got it flowing. We are going to flush it. We've got it flush. We're going to reaffirm. We're going to put our rate back to that TKO or whatever the appropriate rate is. And now we're going to watch our patient and we're going to see. So we're going to check for desired effects and adverse effects. In this particular patient, the desired effect would be the patient would improve their respiratory status and start to breathe better on their own. Undesired side effects or adverse side effects would be flash pulmonary edema, so you need to listen to the lungs, or seizures, withdrawal signs, symptoms, something like that. So that's just what the adverse effects are that we're looking for. And that is it.